monitoring antibiotics where they noticed that resistance for a particular bacterium was rising really, really quickly for a particular antibiotic. And by restricting the use of that antibiotic, the bacteria became sensitive again because they were no longer being exposed to it. So their genes were no longer producing the proteins that made them resistant. And we were able to reestablish utility to the antibiotic. So there's definitely good information that says, at least in some cases, if we use them properly, we will be able to use them a lot longer and even reuse some of the ones that have fallen out of favor. Okay? So this is the kind of information that's out there for the public. It's not perfect, it's not from a medical source, but it makes some sense. And if you hear about that, certainly it'd be wonderful if you talk to your relatives and friends if they have questions, you know, that we all get the information out. We're all responsible for our patients, but also for the health of our entire world. All right, so we're going to be talking about patients in long-term care or post-acute rehab, which is what we do here at Arden. And number one is understanding what's important. There are 5 main infections that will affect our residents. Number 1 and most common is urinary tract infection. Number 2 and the most common cause of death of our residents is pneumonia. Number 3 are skin infections, and these are mostly due to wounds, but can also be cellulitis on intact skin. Number 4 is influenza, and we know that there's an epidemic of influenza every year. We work very hard to vaccinate our residents, as many as possible, and our staff, and our community. Honestly, there's always risk of a visitor coming in and spreading influenza to everyone. And then number 5 are gastrointestinal infections. And these can be viral, like norovirus, which everyone here has probably had some experience with over the years, which can be devastating. It can actually cause a number of deaths and serious complications. And then, of course, things like Clostridium difficile, C. diff, which we're all aware of, and other bacterial involvement of the intestine. So those are the main ones. What we're most concerned about today are bacterial infections. So one of the cardinal things that distinguishes a bacterial infection from a viral infection is the degree of fever and the persistence of the fever. There are also asymptomatic conditions that can mimic bacterial infections, and those also are generally distinguished, number 1, by fever. So what is a fever? Table 1 that I've given you, and this is from a medical reference about treating patients in nursing homes, is a criteria for fever. And what they're recommending is that we consider a persistent elevation, meaning usually more than 24 hours, of body temperature at least 2 degrees Fahrenheit over baseline. So it's not a set number, although